Hi, everybody. My name is Russell Vinik. I'm Medical Director at GBS Benefits. And today I'd like to take a few moments to talk to you all about healthcare consumerism. I'm going to share my slides and we'll get started. So what we'd like to talk about today, number one, overview on consumerism, drivers that have caused this shift to consumerism, how to take an active role in your healthcare, and then finally the risks of consumerism. So let's define healthcare consumerism. And a general definition would be a movement emphasizing patient empowerment, allowing people to make informed decisions about their health services. So we're no longer in this era where doctors just told you what to do, where to get your care, where to fill your prescriptions. People are taking an active role in their healthcare. So let's talk about how we can do that. So first of all, what are the factors that are driving consumerism? Number one is increased cost. So healthcare costs are going up, but in addition, more expenses have been shifted to the patient. Patients more often have high deductible health plans, so they are really responsible for the first few hundreds to few $1,000s in costs in their healthcare. So of course they want to shop and get value out of their health services. There's also a lot more technology out there, which allows people to shop easily. Patients' expectations have just changed lately. They want more out of their healthcare. And then finally, there's a lot more transparency about healthcare costs and outcomes. So we'll go a little bit more into depth into all of this. So first of all, how to shop for healthcare. Well, a good place to start is Medicare.gov. CMS, which stands for the Center for Medicare and Medicaid Studies, requires different vendors, such as doctors, hospitals, home health companies, rehabilitation centers. They require those vendors send them data on outcomes. And now they're reporting those publicly on their website. So I'm going to give you an example from Medicare.gov. And for the purposes of example, I wanted to show the three large tertiary care hospitals in the Salt Lake City area: University of Utah, St. Mark's Hospital, and Intermountain Medical Center. So Medicare gives them an overall star rating, and that's based on a combination of patient survey results as well as true hard outcome measurements. So you can see all of these different outcomes that are being measured. And for the purpose of example, I want to show you if I were to drill down on complications and deaths, I get a ton of data. So there's data on complications after hip and knee replacement. There's mortality amongst people who've had an acute myocardial infarction, heart failure, COPD, pneumonia, strokes. That's all out there and for the public to consume. In addition, they try to risk adjust this data, meaning that some hospitals take care of sicker patients. And so they do a complicated adjustment, trying to show similar numbers based on the acuity of illness of the patient that the hospital is taking. So that allows you to try to make an apples to apples comparison from one facility to the other. Another place that I find useful, ProPublica, is a public service organization. They're not for profit, and they publish data on doctors' prescribing habits. And also, does your doctor take money from drug companies? This is an example of one doctor. Recognize the data can be skewed. Certainly doctors who are specialists, they're more likely to prescribe brand name medication just because specialty medications are more likely to be brand name. But if you're comparing two different primary care providers and one's got double the brand name prescribing than the other, it's something you should think about. Another area is an insurer's provider directory. So every healthcare insurer is going to have a directory. I chose, for example, United Healthcare just because they're one of the largest in the country. And you can see in this example, you pull up a doctor and United has their preferred providers at the top of the directory. So these are providers that, according to United's data, have better outcomes. It'll also show you things like, are they accepting patients in your network? Finally, another good area is a hospital and clinics directory. So on the left here, I took a provider from the University of Utah. You can see this provider has a 5 out of 5 ratings out of 206 reviews. Now, a lot of people like to go to third-party websites like Health Grades. And the reason I'm bringing this up is you can see in this example, I took the same provider on Health Grades. He only had 3 ratings. So, well, why the difference? Well, for someone to get a review on Health Grades, a patient would now generally have to go to that website and be deliberate about posting such a review. So generally people who are going to post those reviews generally have something really specifically good they want to say or something really specifically bad. Whereas if you look at the hospital's reviews, they are going to be surveying all of their patients or almost all of their patients. So you just get a better number of reviews. On the right, you can see the similar from an Intermountain healthcare provider where those ratings are online for patients to see, not just the star ratings, but the actual individual reviews from about those providers. So a few pitfalls on consumerisms. One is publicly reported data can be incorrect or misleading because measurement of quality is just not clear. For example, a patient or providers that take care of sicker patients are generally going to have higher costs and complication rates. And sometimes it's very hard for the data to reflect that. So always think about that as well. In addition, someone shopping for care, that can lead to fragmentation. If they get some medical care at one provider and some at the other, the medical records don't necessarily talk to each other, and that leads to fragmentation of care. And then it's a question we all have to ask for ourselves. When is it worth it to pay more? If we know the quality is better, but it's a very low risk intervention, maybe we want the less expensive provider. Sometimes when the stakes are really high, we should be willing to pay more for those services. So a couple final thoughts. First of all, we have more data at our fingertips than ever before. Our health is important to us, so we should learn on how to use this information. We shop for almost everything we buy, so why not take a little time to shop for ourselves when we're talking about our own healthcare? And then finally, don't be afraid to ask for a second opinion. This happens very rarely in medicine. I can tell you as a provider, I'm never offended if a patient says, I'd like to get somebody else's thoughts on this. Recognize that there's this art and a science to medicine. Two different, very intelligent providers could come up with a different conclusion. And ultimately, if the stakes are very high, I would strongly consider getting a second opinion so that you know what you're getting into, and at least you've had a couple different opinions about your own healthcare. So thank you again for joining us today. Again, my name is Russell Vinik. We continue to send additional information every month, so we really appreciate you joining us today. Take care.